Welcome to Fear with Christine Spratley. Living like a head in charge, the podcast where Christine says fear, questions everything, and takes bold action. Christine Spratley is a former professional boxer, nanny, and 29-plus year corporate warrior turned founder of HBIC Advisors, where she is a public speaker and coach. She's been saying fear her whole life, many times without even realizing it. So tune in, spread the word, and get ready, because this isn't about aging with grace. It's about aging with mischief, audacity, and having a damn good story to tell.
Hello, ladies and gentlemen. This is Fuck Fear with Christine Spratley. Tubbs, everyone. We have been talking about the health aspect that women go through. And today, I'm going to follow up. I think last time we talked about sex. So today we're going to drop it down a notch. But I also think this is a really important topic. And one, I think it's really important because I'm going through it right now. But it's shown me how hard it is for me to advocate for myself. And so today's topic is I'm fine. I'm fine. One of the things that I do when I coach someone is I have them keep a chart. Not a chart, just a little, yellow sticky pad. And I just have them write down how many times they say they're fine. And then I just put morning and afternoon and evening. And then they just those three on the chart. And then they just put a little, one, just keep tabs. And it's amazing what comes back. How many times they're fine. And what's interesting is it comes in all sorts of situations, meaning someone will say, hey, how you doing? I'm fine. Or, girlfriend will call you and you'll be a little bit off and she'll be like, how you doing? Because she knows you're not fine. And you'll say, oh, I'm okay. I'm fine. I'm good. Got this. Good. Husbands, you guys do this to your wives all the time and go, oh, yeah, we're fine. And she ain't fine. It was funny. Joe, I asked you and I told you what the topic was. And you're like, yeah, I'll say it. What did you say? Say it one more time?
Yeah, say it one more time and I'll believe you.
Yeah. But we kind of laugh about that. But how often does it become kind of our mantra? And what that leads to and what has led for me is to say, I'm fine. And what that does is it puts a layer on top of everything. And today I'm going to talk a little bit about the health aspects of being fine when you're not. And a couple of things happened to me recently. And one of them was, as I've spoken about here, I've gone on hormone replacement therapy, HT, HRT, whatever you want to call it. And I went into my doctor for a scheduled update, or I don't even know if that's what you call it, a scheduled update. It was just hey, they put a pellet in, I've been taking hormones, what's going on? How you feeling? I'm fine. I was good that day. So I didn't use fine, but I was good that day. And she started asking me, and I said, and I couldn't give her more description. And one of the things she said to me is, you've got to start listening to your body and figuring out not just when it's bad, but I want all the details. And I've never had a doctor kind of want all the details, unless it was me having in the ER or something like that. Then they want all the details. But it kind of goes to that thing of, how do I prevent the ER visit? How do I prevent that? Why am I not listening to my body, paying attention to it? And I think I spoke at either the last segment or the previous episode to that about, yes, we do our body scans and we do yoga and we get our facials and we, do, and maybe some of you are very, very in tune, because I was very in tune, especially when I was a boxer. I was so in tune with my body. But as life went on, I started to kind of go, oh, well, I'm getting old, and this is what that ache means. I'm a doctor. I don't know what that ache means, but I have Google and I have chat, so I'll look it up now and get just enough knowledge to be dangerous. But what's interesting is I still dismiss it first. And so that was one thing that happened, where she was like, no, you need to tell me so I can tell you what's going on, whether it's working or not, what you need to pay attention. And it's been a lot harder than I thought it was, because like we all do, there's 100 million things. You got the kids, you got the boss, you got the team, you've got this meeting, you've got this plane to catch, this car to drive, this gas to get, groceries to unload. I've still got groceries in the car from this morning. So I get that. But how are you doing? How is your body doing? And what do you know? And it's like I used to say to my team, do you think or do you know? Do I think it's doing okay? Have I even checked in on it? Or do I know that it's okay? Do I know that it's fine? So that was one. The other has been, I've never had any sort of back issues in my whole entire life at all. I've been very healthy for the most part. I've had some weird illnesses type of stuff, but I've never had back issues. So I've never had back pain. And starting last year, I started doing the evolution walk when you get up. You know how you get up and out of bed and you can't sit straight up. So, that started about 1.5 years ago. And then last year it got really bad. And then January of this year, I started having immense pain. And I've been going to my physio, and Nate and I were working on it, but it was going worse and worse. And I finally went in at the end of January, and I went to an ortho emergency place specifically for back. And I went in and met a wonderful PA, and she said, "Oh, this is what it is. It's, this is probably what it is. We're going to do an x-ray." And I didn't know at the time, but I was explained to that x-rays don't tell you much, but it's the first step. And so again, I was busy. It's just nothing. And Joe was asking me before the segment, he's like, what pain level? And I have a really high pain tolerance. And they gave me some stuff. I told them I'm recovering, so I don't want anything that's addictive. You need to tell me. So if I can, if I take it, then I can give it to somebody else to dole out my allotment. I just don't do that. So they gave me some stuff. I came back like a week later and I was like, no, it's bad. And they're like, well, okay, try these. And so I tried that for 2 weeks, nothing. And it just was, literally there are days now, but I walked in that day and I was like hunched over, and so they gave me shots, and again, it's nothing, no MRI. And I was like, and she said, well, why don't I'll schedule you with another doctor. One of our orthopedic doctors or something. And I said, okay. So I waited a week, and still in just tremendous pain. I've got salon paws all over my back. And so I go in, and this is what was interesting. I go in, and this, I don't know if he was a nurse or I don't know the specialty that he was, but he walks in and he says, okay, you're here for a shot. I said, what? I had no idea that they had just scheduled me for a shot. And I said, no, I've had 2. Like I've had one in each side, same day. It didn't help. And I said, we need to catch up. And one thing I had done, I had written up a whole documentation. And this I suggest women, men, anybody, when you go in, and chat can do this for you. It helped me. It wrote up my whole history of it and just put it in medical terminology ease. So it was very clear. And I just was like, here, you need to take a look at this, because I wasn't sure. One thing I do know is I'm not sure the next doctor is going to get the full story. It's kind of like telephone. People tend to pass on what we think is important. But I'm not a doctor, so I don't know what's important. And if somebody already has diagnosed you in their head, there's a higher likelihood that they're only going to pass on what information they deemed important. So one of the things I said to him was, I'm not sure of my diagnosis. So the young man was a little caught off guard, to say the least. And he said, okay, all right, because I probably was a little gruff. And to be really honest, I really didn't give a shit, because I'm in pain, okay? All right, back up. And I don't just, it's not like I pop pills, fuck you, I'm in pain. And so, and again, he's meeting me for the first time that, he's just going, well, who the hell are you? What? And so I kind of tone it down a little bit, of course, because I realize sometimes that can be off-putting. So tone it down. And I say, I just need the doctor to spend some time with me. And the doctor came in and quickly informed me that my diagnosis was just arthritis. And, in the back and I said, and I was really like, well, listen, I've had this go on and I go to a physio regularly and none of this stuff has worked. Can I get an MRI? And then we had this weird discussion about affording an MRI. And I have health insurance. And I was like, I don't care. I don't care. I was like, because I knew I'd been told I have some friends, and I did some research that you can't see the discs in an X-ray. So I knew, it was like, this is what the next step is, to get an MRI. And so he begrudgingly did. And I walked out and I was there for like maybe 15 minutes. I clocked it at 11, but I got in the room a little bit early, so it could have been 15. And that's the whole time in and out. And I'm walking out and I'm angry and I'm pissed and I'm in pain. And I'm like, all I want is someone to go, this, because one thing I realize is that he may not be able to help me, right? Like, that's not his deal. He's not a surgeon. He doesn't do spine. He doesn't, so I'm like, well, what should I do? Like, who should I see? What's the next step? And so I get my MRI. My MRI comes back, and right now I have 2 bulging discs, a herniated disc, and a tear, and it's leaning up against my spine, and that's pinching the spine, and that's what's causing all my pain. And it was really interesting because I checked in to get my MRI, and the girl that was checking me in, that was taking me back, she was so gracious and just warm and welcoming. And she said, hey, who's your doctor? And I was not happy with this person. So I said some smart ass remark, and she looked at me, and then I just said, and I told her, I was like, and she goes, oh, don't you worry. We're going to take care of you. This is going to be fine. We're going to, and it was just amazing, just that little kindness of listening. And then this came back. And so now I have an appointment next week. They're going to try and get me in earlier, with another doctor, a different doctor, and a neurosurgeon. And, we'll see what happens. So I'm experiencing this. And what I'm experiencing is, one, I'm noticing that I'm not taking note of how I'm really doing. I'm not checking in with this body. Oh, it's a temple. Women are beautiful. Woo, we are these wonderful things. But do we treat ourselves that way? Or are we just fine? And again, me being a head bitch in charge means that I need to treat me that way. Like, I need to treat me like a temple. I need to educate me on my body. It's not up to everybody else. Yes, I'm not a doctor, but I need to be able to articulate and talk to a doctor and advocate for myself. So if I'm constantly telling myself I'm fine, what gets imprinted in my brain? What happens? And typically, I'll tell you, for me, it becomes not fine by the time it's way past go. By the time it's fucked up, And even when you ask me, Joe, about what's my pain level, it's like I want to dial it down a notch.
Yeah.
And
I don't know why we do that. My wife does that too. I remember one time she had a really bad earache, and we ended up going to the emergency room, and we wait for like 4 hours. They've given her like baby Tylenol, until they go wait again, until we finally get to see somebody. And we get back there, and the doctor's like, what's your pain level? And she's just been crying. And my wife's got a super high pain tolerance, too. She's like, 2. And I'm like, what are you doing to yourself?
Yeah, stop it.
We're going back out there. There's
and I think part of that is we, and again, I think women will understand this, and I think men will too. We're told from a very early part of our life, oh, you're crazy, you're crazy, you just come on, pipe it down, and so just deal with it and go. I mean, I can't explain how many times I've been in conversation with women, and we've been like, well, yeah, we just go do this. And it's like, I had a conversation with a woman today. I was getting groceries, and I was hunched over on the cart, and she was helping me find some stuff. And we were talking about menopause, and we were talking about all the symptoms. And she's like, yeah, we just go on. We just go on. How crazy is that? We just go on, but yet we want other people to treat us better. We want our daughters to be treated right. We want our sons to grow up and treat their wives well, but we just go on. And I'm not going to go on anymore. I'm going to pay attention. I'm going to learn how to deal and to take care and to hear.
Christine Spratley doesn't hide her life. She's real about it, warts and all. After leaving 29 plus years in corporate, she founded HBIC Advisors with one mission: be a fierce ally for women to stop waiting for permission to live boldly. If you want your audience to unapologetically run until apprehended toward fulfillment, Christine is your next podcast guest. Warning: may cause spontaneous HBIC badassery. Book her now at christinesprattley.com.
I did some research about this, and now women, we've always heard we've got women's intuition or a sixth sense. And there was a study done, and it revealed that 77% of women believe they have a sixth sense. I think we all do, but they have an intuition about their health and significant life decisions. And the study showed, this is why I want you to trust yourself, that almost 70% of the time they were right. They were accurate. And it wasn't that they could pinpoint everything exactly, but they knew something was up and something wasn't right. And again, ladies, I never thought I had women's intuition. And that's because I wasn't listening to it. Think about this. I literally did. I thought, oh, I don't really have intuition. But it was my level of listening to myself was so low at that point in my life that I turned everything off. And I just, it wasn't like I numbed one thing. It was like it was across the board. And then this is what's also the same study. Women typically ignore their initial intuition about health warnings, and with about 60%, it's 59%, failing to heed early signs of potential problems, and 60% not acting until symptoms disrupt their daily routine. And I think the numbers are just crazy, but what really got me was our daily routine. I tend to not think of it being a big deal until I can't do my daily routine. And that's like going, like it disrupts my daily routine. It's not like, oh, I'm uncomfortable. I mean, I've soldiered on through so much crap. And I just love those period pain simulators that the guys wear. You see them on TikTok now and stuff like that. But it's like we do that. That's all. We have that all day long. And one of them that I was watching was the woman, and the guys were sitting next to each other, and the guys were like under the table. And the woman was like, yeah. And do you need a cup of coffee with that report? And we laugh, but this is the level we hold ourselves to. And women spend 25% more of their lives in debilitating health. And that's according to a report from the World Economic Forum and McKinsey Health Institute. 25% more of our lives in debilitating health than men. And that's because we ignore the signs. We don't listen. We don't advocate. We don't have the information. And that's why I'm just, please listen. You can always stop listening. You can always go up, but take note of it and see. Again, how many times do you go through your day and go, I'm fine. Everything's good. Oh, it's just a tweak. And that's what it was for me. It was just a tweak in my back. It was just, I thought I was just getting old. I must have slept wrong for the, 2-week, second week in a row. Oh, it was just stress. It's just stress. Okay, well, that's my body telling me it's not dealing with it very well. Maybe something needs to change. So the other part that's interesting of this is when I do this, when I don't listen and don't pay attention, I am less likely to delay or skip my medical care. My husband never liked to go to the doctor. I hated it. Okay. And he'd put stuff off and put stuff off. But what would happen with me is I would put the little stuff off. The little stuff. And then next thing you know, I have to go to the doctor. So there's another study, and this was by my old firm, Deloitte. Women are 35% more likely than men to report having skipped or delayed medical care over a 12-month period, leading to untreated conditions and compounded health issues. What I thought was really interesting about this was, one, it doesn't surprise me that we're more likely to delay that, to just skip it, because we're busy. Oh, well, we'll do it tomorrow, or we'll do it when the kids get back in school. We'll do it when I get done with busy season. It's busy season right now for everybody at the big four firms. We'll do it once we get back from doing this work trip, or I just didn't get around to it this week. It just wasn't on my calendar to do. And part of that, though, was it's over a 12-month period. So it doesn't say, like when I was looking at this, it means, to me, that means I've had the symptoms for a long time, and then I've delayed it over the 12 months. So I'm not sure how long it was before I started listening to the symptoms. I'm just amazed at, for me, how I thought I was so taking care of myself, and I really didn't have that much active participation in listening to my body. So what does this mean? For me, there are some things that I know for sure a fact I used to do because I didn't advocate for myself, because I didn't listen to my body. I would find a very hard time having experiences with my physicians, doctors, gyno, anybody. I had a hard time articulating. And if they, for a long time, I said, if you tell me what it is, I'm going to go with that. Even if I was like, huh? And I've talked about being menopausal, and no one ever really talked to me about it. No one ever brought it up. No one said, hey, this is, when we did bring it up, it was just, well, you're going to go through that. It wasn't like, hey, this is what's happening with your body. And yeah, you shouldn't have any pain. I think in the last episode with Rhea, we were talking about, why is that normal? Why is that normal? Just because it happens? Okay, well, it might be normal, but let's do something about it. Is it, is that the normal that I want to live with? But so it's reported that nearly half of all women between ages of 18 and 35 who encounter healthcare in the prior 2 years when they took the service. So they looked back over the past 2 years, nearly half reported a negative experience with their healthcare provider, which discouraged future medical consultation. And if I go in there with not knowing not being armed and not being ready to say, you're the expert and, yes, and what are we going to do about it? Yes, and I want a second opinion. Yes, and the next question. If I don't go in there with any of that, then my whole body, life, quality of life is purely dependent upon them. I am not an active participant. And I used to say this I always loved active participant clients, even if they were the crazy ones, because they were in your stuff and they would and you would be on your toes and they would give you feedback and you would give them feedback. And yeah, not the really super high maintenance. They were the pain in the ass, but still they were active and you got information, which then you could course correct. And if I'm not an active participant in those rooms, then when I get a discouragement for future medical consultation about this, and I just accept it, I go on. And I know this for a fact with me. Once I start down that slope of it's no big deal, it doesn't hurt that bad, it's so much harder to get it, to make it up, because then I feel guilty and then I feel bad. Like it's really bad to go in my head and go, well, I've been dealing with this. Well, they always say, what is it? When did you first start to have symptoms? And you go, about 6 months ago. And they just kind of look at you and you're like, yeah, I know. So again, if I'm not going to participate, if I'm not going to advocate, and I can't advocate if I'm not paying attention and I'm not engaged. I think it's really also very important for women to understand that symptoms related, and they're not just hormones and things like that. It's everything. All sorts of symptoms can lead to misdiagnosis or inadequate treatment. I mean, how do I say this? Experts are experts, but they're not always right. This goes back to one of my first episodes where I said, I want everybody to start asking as many whys as possible. Why, what, who, how, when. A why shouldn't scare anybody. A what, it shouldn't scare anybody if they know their stuff. I've never walked into a room and got upset with a client who made me explain something, even if I've had to explain it 50 different ways. If I felt strong and it was right, and my ego was in the right place, and my interest is to do what's in their best interest. I've only gotten upset when people come at me, when I feel defensive, when I don't know, things like that. But this is a doctor. They know a lot more than we do. But this is my body. So why shouldn't I understand what's going on with it? Explain this to me. And there was a small study done, and this was not on anything female oriented. This was just a regular study, right? And again, there's this biased study found that, and it was a WebMD study, and I can give you all these links if you want them. To the different studies I'm referencing, where they found that women with knee pain are 22 times less likely to be referred for a knee replacement than a man. Now, there's lots of things, when I was reading it, there's lots of things that can go into the reason why they do that, right? Not just, oh, you're a woman, whatever. But what I thought was interesting about this is just the fact that it's just a referral. That if you look at this, it was just a referral for a knee replacement. It was saying, hey, yeah, we think there might be enough there. It wasn't these say, hey, because then they were going to be referred to a doctor who would then evaluate them to go in and whether or not they actually really needed to have one. So I thought that was interesting that even at that referral, it's like, And so what I tell you, women, is we got to advocate for ourselves. And that, I don't know, that's just blows my mind that it's not that they're not on my team. It's just they're not showing up. I'll put this in football. Somebody missed their block.
Yeah, I mean, you said in your story that the guy was practically getting ready to give you a shot, and you're like, yes, but for what? Nobody's told me what I have.
Yeah, well, and this is how defensive they got. They're like, well, it's in your notes. And I'm like, but no one sat down and talked to me what that meant. And even if it is in my notes, I still have questions because, and this is funny, this is why I had so many questions, is because if it's arthritis, then it should been treated by the 4 things that you've already given me.
Yeah.
But it was just like, it was like that. It was so amazing. I just really want to encourage all of you ladies out there to quit being fine. Okay? Be amazing. Hold your standard higher than fine. Hold your standard higher than, I'll wait till the kids get done with this, or I'll wait till he gets off of work and gets back from golfing, or I wait for whatever. I'll wait till I get done with XYZ report to get my sleep, to get this, to get that. I'll wait. Okay? But what happens when we do it? Like, what happens when we do show up and advocate for ourselves? More females than males seek second opinions. Among patients with general medical concerns, 52 to 61% of those sought second opinions were females. I love that. I love that. We start, and that's what happens when we start to listen to our intuition, when we start to get the knowledge, when I quit going, oh, I just don't feel good. And I look at my body and go, oh, no, my body is having a reaction to something. And I take myself seriously, then I start thinking critical more often than not and go, no, I want a second opinion. No, I want some more information on this. Women are 10 times less likely than men to have their pain level assessed when they arrive at the hospital. And you talked about your wife. And wait approximately 30 minutes longer than men to see a doctor. So again, when we do advocate for ourselves, don't just think that everything's going to go like, oh yeah, you're advocating for yourself. This is good. No, you're going to need to go in and you're going to say, hey, listen, I've been here a long time. Because I used to have asthma attacks, and I remember driving to the ER, having an asthma attack, and getting there. And I remember calling my friend, and he was like, hey, and I go, no, I'm already on my way. And then when I got there, I remember I was so used to knowing and being familiar with it that the lady was like, okay, I mean, I knew because I'd had him so often, but yet they're very scary and they're very much, you need that nebulizer. And she just they just let me sit there. And I would walk up, and I put a timer on my clock, and I was like, okay, go up and I usually, when I do a timer, it's literally on my phone. It's called medical timer, and it's like 7 minutes because I don't do 10 and I don't do 5. So when you advocate for yourself, you've got to do it all the way through. And I was talking to a friend of mine this past weekend, and we were talking about her daughter. And her daughter has a disease, an autoimmune disease and I'm going to get it wrong, so I'm not even going to try. But it's this, basically, she was one of those that almost died during COVID because of it. I mean, it's not fun. It's not funny. She has infusions every 2 weeks or so, and it's a lot. And we were talking about, I said, yeah, you should really go to medical school. He said, because you not only retain this information, but in talking, you're able to, relate it and talk out of it. Most people, like when I knew the kids, when they had issues or something, I knew what happened to them, but I couldn't take it and do anything with that information. Like if someone said, oh, my kid's got this, I'd be like, oh yeah, they had it too. But that's as far as I could go. She's a really brilliant woman. But what was really interesting is we started talking about how in tune she was with her daughter's health, but not her own. And I thought that was really interesting. And so thus we started talking about, again, how we take care of you. We take care of someone else. We're given a doll. What if that doll that they gave us was, they said, hey, this is you. This is you. And you're going to take care of you the rest of your life. So be good to you. You know, how are you going to treat you? Not doll Susie, doll Christine, you know, treat you like that. And you've heard me talk about my friend Grace, my coach friend Grace, and she always says, you know, how would she treat friend Grace? And so I do that. How would I treat friend Christine? And so I'm asking you ladies and gentlemen, how would you treat your daughter? Why don't you advocate for yourself like you advocate for others? What would that look like? Because I know some of y'all are like big old mama bears. I've seen them in action. And if you're looking to support a woman in any way, shape, or form, one of the best ways that I've come across about saying, hey, I want to show up for you is literally to say, please tell me how I can show up for you. And it does a couple things. It says, I want to show up for you. It doesn't say how. Doesn't say any of that. It just puts it out there. And so the other person who's receiving, the woman that's receiving this, gets to say back to you, gets to look back at you and go, this is how you can show up for me. And I typically, this happened with a friend of mine whose husband recently went through surgery, and she's older and kind of has that depression era mentality. And I just said to her, I said, I would like to show up for you. So I'm going to ask you, how can I show up for you? And nothing, like I've got it covered, is not an acceptable answer to me. I don't care if it's get the mail. I don't care if it's call me on Tuesday. I want to show up for you. And so I take that and I sit sometimes and I go, Christine, how can I show up for you? How can I show up for myself? How can I advocate for me? And part of that means slowing down and taking the time to listen to my body. And this will lead into another segment that I'm going to do next. And it talks about the slowing down and how hard it is, because to me, it's never the engine that gets you. It's usually not the middle. It's always that damn caboose that comes back and smacks you in the head. And so when I slow down, when I do it now instead of later, that means that I have to take a look, and I look at everything. And there's a lot of fear wrapped up in that. You know, what happens if something isn't right with your body? You may have to change something. You may have to change the way you eat. You may have to change what you're doing. You may have to change your schedule. You know, you may not be able to go do the things you like to do for a while. And so what? Aren't you worth that? So again, the next segment will be on, you know, looking at slowing down and why we're so crazy busy. But today, when you leave with this, I really just want you to sit there and think for a second and start off with that simple list. How many times do I say, I'm fine, I'm good, I'm okay? And I used to joke all the time when Brady was in high school. He had like the three words and that and bruh. Everything's bruh. Was good, fine, okay. And when I start talking like a teenage boy to describe me over and over and over, I'm not checking in, or I'm not being honest. And if I'm in a situation where I'm not being honest because I know the truth and you can't handle the truth, then that's bigger. But I need to start being honest, at least to myself. And I know everybody, this is the great thing. Everybody doesn't give a shit how you feel. Like when they say, how you doing today? You know, they don't always want to know. But what I've learned is when I tell them, they quit asking that stupid, annoying question. And they just wave and, hey. And then the ones that do want to know, and I'm not saying I verbally tell them, vomit on them and tell them everything, but I may say fair to partly cloudy, just whatever it is. I don't have to give them the rundown of my urinary tract infection. But I can go, I'm a little off center today. My back hurts like a moho, whatever it is. And just because that you're telling, you're honoring. And again, the ones, I remember Salima, the one who runs one of the women's groups that I'm in, she was talking about how she showed up at school one day. And I think most moms can respond. And Joe, you probably can too. I don't know if you can or not, but busy, dropping the kids off, blah, 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 backpack in hand, and she came in and she was a wreck. She was crying, sobbing, it was a banger of a morning. And she said all the moms just parted like the Red Sea. And then she said what happened next is all the ones that are still there that, just came around her. And then we're like this little bubble that huddled up with her. And that's also what's really great about when you're checking in with yourself, you're advocating for yourself, when you're knowing your truth, you're willing to look at it and you're willing to own it. The people that can't handle it tend to get the fuck away. And I don't know about you, but I want somebody that when shit does hit the fan, it's not when they decide to get the hell away. It's not time for us to figure out, who on your O line is going to block. No, I want to know that before I go into battle, before I hit the hard times. And if I'm not honoring my truth, if I'm not saying it, and you can't handle it on a day where, my back pain is 5, this weekend, I was a total, not a nice person. I was so bitchy and I was just irritated and I kept losing shit. Can't find my remote. And I love my remote control. And my friend was like, Camo was just like, yeah, I knew. You're in pain. And I had to call her today on the way over, Joe. And I just said, hey, thank you. Thanks for letting me be this way. But I don't get to do that if I'm going, oh, I'm fine. Oh, I'm fine. Be better than fine. You have the opportunity, and why shouldn't you? Why would you want to spend one more day just being fine? Even if you're okay, be great. Treat yourself like the human that you are supposed to take care of. If you say you're a temple, treat yourself like a temple. Understand what that temple is. Listen to that body. And don't just whitewash it and say, oh, it's me getting old. Oh, it's this. Okay, well, let's see, is it? And then let's do something about it. You can. Even if it's just 1% better, wouldn't that be 1% better? I mean, 1% better every day for 365 days? So give yourself the gift. Because no one else can give it to you like you can. You can't get what you want. You can't get what you deserve if we don't ask for it. This is an incredible body we have. And I'm still learning. I'm 54 and I'm just now learning a lot about it. So if you're younger, do it. Do it now. Don't wait. This is what I mean by being a head bitch in charge and being accountable and self-responsibility. So until next time, ladies, be better than fine. Expect more, demand more of yourself and then others, and give yourself that gift. Tubbs.
Thanks for tuning in to Fear with Christine Spratley. Living like a head in charge. Don't forget to subscribe, leave a review, tell her what topics you want to hear, and share this episode with someone who could use a pantry full of boldness in their life. Remember, life isn't about aging with grace. It's about aging with mischief, audacity, and having a damn good story to tell. So show up, take action, and keep saying fear.